Morning to all. Today we are going to discuss about the drugs which is used in cancer chemotherapy. And we know all that what is cancer. Cancer, which is the uncontrolled, purposeless proliferation of a group of cells, and it is characterized by metastasis. What do you mean by metastasis? It is the process of spreading of the infection or the tumor cells from one place to another place. Okay, and the main characteristic feature of cancer is metastasis. Next is about the phases of cell cycle. We know the various phases of cell cycle. There is G1 phase, M phase, G2 phase. Okay, then S phase or synthetic phase, then dormant phase. And the cancer cells which causes an abnormal cell division. So we give the drugs in order to inhibit the cell division or inhibit the over cell division in the cancerous cells. So the drugs can be classified into alkylating anti-cancer drugs such as nitrogen mustards. Examples: cyclophosphamide, ifosfamide, chlorambucil, and melphalan. Next one is nitrosourea derivatives. They are carmazine, lomazine. Then alkali sulfonates such as busulfan, platinum compounds, cisplatin, carboplatin, oxaliplatin. Then triazines such as dacarbazine, procarbazine, ethylenimine, thiotepa. Next one is anti-metabolites, folate antagonist, methotrexate, purine analog, 6-mercaptopurine, pyrimidine analog, 5-fluorouracil. Then natural products such as anti-cancer antibiotics, actinomycin, doxorubicin, bleomycin, then taxanes, paclitaxel, vinca alkaloids such as vincristine and vinblastine, topoisomerase inhibitors such as topotecan and irinotecan, topoisomerase 2 inhibitors such as etoposide and teniposide. Then hormonal anti-cancer agents are glucocorticoids such as steroids, androgens, estrogens, aromatase inhibitors, and others are interferon alpha, interleukin 2, hematopoietic growth factors. Okay, so we are discussing about alkylating anti-cancer agents, anti-metabolites, anti-cancer antibiotics, and vinca alkaloids in detail. First one is alkylating anti-cancer agents, and example is cyclophosphamide. Cyclophosphamide is an alkylating anti-cancer agent which will transfer its alkyl group into the various sites of DNA, and they results into the inhibition of DNA replication, abnormal base pairing, breakage in the DNA strands. Next one is the ADR of cyclophosphamide. The main ADR of cyclophosphamide is that hemorrhagic cystitis. It is the irritation of bladder mucosa. It is due to the production of an acrolein, which is a toxic metabolic product of cyclophosphamide, which is formed from a precursor called aldophosphamide. So, how will you manage this hemorrhagic cystitis in those patients who are taking cyclophosphamide? How will you manage? Yes, we can manage it by adequate hydration, giving mesna intravenously, and this mesna is a compound which can inactivate the acrolein. Then we can go acetylcysteine for such patients. Then other area of cyclophosphamide are bone marrow suppression, which leads to granulocytopenia, leukopenia, thrombocytopenia, etc. And vomiting, alopecia. Alopecia, which means loss of hair, which is a main ADR of anti-cancer drugs. Then, uses of cyclophosphamide. Cyclophosphamide is mainly used in lymphoma, chronic lymphocytic leukemia. What do you mean by lymphoma? It is a cancer in the lymphoid stem cells. Then, leukemia means the cancer in the WBC cells. Breast cancer may also cause. Due to immune suppressant action, cyclophosphamide can be given in inflammatory situations such as rheumatoid arthritis and nephrotic syndrome. Next one is cisplatin. Cisplatin is an DNA synthesis inhibitor and which can cause cytotoxicity or cell toxicity. The ADR of cisplatin is that peripheral neuropathy, nephrotoxicity, that is the toxicity in the nephrons, autotoxicity, that is the hearing impairment. And cisplatin can be used in testicular cancer, ovarian cancer, endometrial cancer, and bladder cancer. Next one is methotrexate, which is an anti-metabolite, which is a folate antagonist, which is cell cycle specific agent, mainly act on S or synthetic phase of cell cycle. Then the actions of methotrexate are anti-cancer action, immunosuppressant action, anti-inflammatory action. Next one is the mechanism of action of methotrexate. It is a folic acid antagonist. They competitively bind to dihydrofolate reductase and prevent the formation of tetrahydrofolic acid. The deficiency of this tetrahydrofolate or dihydrofolate reductase enzyme which leads to impaired folic acid and protein synthesis. As a result, the purine synthesis is inhibited, thereby the synthesis of DNA and RNA is also inhibited. Next one is, here we can see the mechanism of action of methotrexate. As I already said, methotrexate, due to the inhibition of dihydrofolate reductase enzyme, it will inhibit the synthesis of proteins. Next, we can discuss about the ADR of methotrexate. The main ADR of methotrexate is bone marrow suppression, such as thrombocytopenia. On GIT, it can cause nausea, vomiting, diarrhea, and bursitis. On skin, it can cause alopecia and dermatitis, teratogenicity and abortion, nephrotoxicity. How will you manage this area? Which can be managed by giving folic acid or folinic acid, which is otherwise called leucovorin rescue for such patients. So why we give folinic acid instead of folic acid? Because that this folinic acid will be converted to a form called tetrahydrofolic acid. This can be easily utilized by the cells. Then, uses of methotrexate. Methotrexate is mainly used for the management of choriocarcinoma, that is a placental cancer. Then they can be used in acute leukemia or blood cancer, breast cancer. Due to its immunosuppressant property, it is given in rheumatoid arthritis and psoriasis. Next is the anti-cancer antibiotics. Here we can see the antibiotics actinomycin D, bleomycin, doxorubicin, and daunorubicin. This actinomycin D may cause bone marrow suppression, nausea, vomiting, and mucositis, and it is mainly used in Wilms tumor, rhabdomyosarcoma, or muscle cancer, choriocarcinoma. Wilms tumor is kidney tumor. Then bleomycin can be used in lymphoma, squamous cell carcinoma of head. Doxorubicin is used in acute leukemia, breast cancer, ovarian cancer. Then daunorubicin. Daunorubicin is mechanism is same as that of doxorubicin, and it is mainly used in leukemia, breast cancer, ovarian cancer, etc. Then the main ADR of actinomycin is bone marrow suppression and can cause nausea, vomiting, mucositis. Bleomycin can cause pulmonary fibrosis, edema, nausea, vomiting, and alopecia. Then the doxorubicin causes bone marrow suppression, nausea, vomiting, and cardiotoxicity. Then danorubicin. Danorubicin is same as that of doxorubicin, which can cause red coloration in the urine. Next one is vinca alkaloids. The vinca alkaloids such as vincristine and vinblastine are used in cancer chemotherapy, and these vinca alkaloids are obtained from a plant called Vinca rosea. Okay, the vinblastine and vincristine, they inhibit the beta tubulin, thereby inhibit the polymerization of DNA and inhibit the formation of mitotic spindles. So the cell division will be arrested in the metaphase. And the main area are bone marrow suppression, nausea, vomiting, diarrhea. Vincristine can cause peripheral neuropathy, alopecia, and bone marrow suppression. The blastine, that is, vinblastine is mainly used in breast cancer. Vincristine is mainly used in childhood leukemia, childhood tumor like tumor, and neuroblastoma. Next, we can discuss about general adverse drug reactions of anti-cancer drug, which was a previous university question. So, bone marrow suppression such as leukopenia, thrombocytopenia, anemia, these are the main area of anti-cancer drugs, and it can be managed by proper blood transfusion and the transfusion of adequate growth factors. Next is the nausea and vomiting, which can be managed by giving ondansetron, which is an anti-emetic agent. Then alopecia, stomatitis or inflammations in the mouth, glossitis, mucositis, bleeding from oral lesions. Then anti-cancer drugs are contraindicated in pregnancy because of their teratogenic potential. Then they can cause hyperuricemia. It is due to the lysis of tumor, so the uric acid will be accumulated in the blood body. So it can be managed by giving a compound called a rasburicase. The rasburicase is a xanthine oxidase enzyme inhibitor, thereby inhibit the production of uric acid from purine metabolism. Then the main ADR of anti-cancer drug is carcinogenicity, that is a secondary cancer. Okay, then we are discussing about various anti-helminthic agents which is used. What do you mean by helminthiasis? Yes, helminthus, which is a various kinds of worms. So these drugs are mainly used in order to eradicate the worm infestations from our body, or they are called deworming agents. Okay, there are several kinds of worms are there: roundworm, flatworm, hookworm, whipworm, pinworm, etc. Okay, so we can see some anti-helminthic drugs which is used. That is broad spectrum anti-helminthic agents, nematode against agents, trematode and cystode treating agents. Albendazole, we know about albendazole, which is mainly used in worm infestations and which is a broad spectrum anti-helminthic agent. Then nematode drugs are ivermectin, diethyl carbamazine, pyrantyl palmitoate, levamisole, and piperazine. Then the drugs used against cystodes and trematodes are praziquantel and niclosamide. So coming to albendazole, this is a broad spectrum anti-helminthic agent and it has certain advantages because which is effective in single dose. We know that a single dose of albendazole is very effective against the worm infestations. Then it is also used in hookworm, hydatid disease, neurocystic sarcosis, etc. The mechanism of action of albendazole is that it is a beta tubulin inhibitor. They inhibit the uptake of glucose by the worms and causes reduction in ATP production and death of the worms. Then ADR of albendazole, it can cause nausea, diarrhea, abdominal pain, headache, and on prolonged use, it can cause jaundice, alopecia, granulocytopenia, etc. Then uses of albendazole. It is used mainly in nematode infections, single dose 400 milligram, then used in tapeworm infections, etc. Okay. Then in hydatid disease, albendazole is also a drug of choice and it is used in filariasis along with diethyl carbamazine or ivermectin. Okay. Here we can see the mechanism, uses and area of pyrantel palmolate, piperazine citrate, levamisole, prasik, vandal, and closamide. Antifilarial agents are DEC, ivermectin, albendazole. Okay, and this diethyl carbamazine is also used in tropical eosinophilia. The ivermectin is used in onchocerciasis and as chemotherapy of filariasis, and also it is used in scabies. So, hope you will understand about anti-cancer drugs and anti-helmintic agents. Thank you.